Good morning, everyone. I know a lot of you have spent time either emailing me or getting emails from me, meeting with me one-on-one. So it's kind of exciting to actually be able to come together to host this training and sort of provide an overview on all of the resources, the new resources that my team and I have been working on, and now that they're available and it's local wellness policy season, as a lot of you know, I've been either accepting the waiver or working on the triennial assessment. So I'm very excited to walk you through what the new resources are, what the local wellness policy is, and how we can work together to benefit your school community. So we can go to the next. Okay, yeah, so here's our agenda. Just providing a brief overview of what the local wellness policy is, how it got started, where it came from, the legislative requirements that's federal from USDA, and also some local level local wellness policy requirements that exist. We're going to go over the local wellness policy guide that will provide some background on what that policy is, kind of what we're going to go through with the legislative requirements. We'll then review the new template and requirements checklist, discuss some of the pieces of evaluation, including the triennial assessment and the rubric that was designed to help you complete that. And then we'll talk about some next steps at the very end. So for those of you who aren't sure where this came from and why you have such a big lift on your plate, it's a result of a series of laws that got progressively more detailed. So the first one was Child Nutrition Special Supplemental Nutrition Program for Women, Infants, and Children Reauthorization Act, mouthful. And that's where they first came from. Local wellness policies were required at the start of the 2006-07 school year. In 2010, Congress added a little bit of teeth to it with the Healthy, Hunger-Free Kids Act, and that's where implementing it, evaluating it, and reporting on progress came from. So initially it was like you have to have the policy or implement it, but there was actually no evaluation and there was no way to keep track or measure whether schools were actually doing that. So that's the first two steps. So in 2016, the final rule added the evaluation piece to it and required triennial assessment be implemented. And that is just that at least every 3 years, schools have to assess their policy, how effective it is, how it compares to models. And we'll talk about this in a little bit more detail. But they are collected. Our process at OSSE is collecting them during your administrative reviews. The triennial local wellness policy reviews are also required by the Healthy Schools Act. So that's one of the examples, and I just put it in here up front so it's front of mind. That's an example of where there's a federal requirement and a local requirement that overlaps. Okay, great. So we're going to first talk about some of the legislative requirements. Both, as I said, federal and local requirements exist for this document, for the policy itself. And then these requirements are requirements. And what that means is they must be included in the actual local wellness policy. It is not a requirement that you have to do, but don't have to write about, describe, include. So anything that's required is required to be included. That's what it means for the local wellness policy. And there are policy requirements related to content, like what needs to be included, if something needs to be described, if a goal has to be stated. And then there's a process requirement, sort of like how we're doing something. So that's what I mean when I say content and processes. So we're going to go into a little bit more detail around that in the next couple of slides. So first, the content requirements, as I stated before, they have to be included in the actual policy. So goals for evidence-based nutrition promotion and education, physical activity, any other activities that promote student wellness. And it's school-based activities, right? So if your school has a Saturday bicycle club that doesn't meet at the school, that is not actually something that you would include in the policy. As far as meeting that requirement goes. So policies for food and beverage marketing, policies and standards for food and beverages that are provided and not sold, then also those that are sold, then there's alignment to smart snack standards. So making sure basically that the children are eating healthy foods that meet or exceed the USDA requirements. You're more than welcome to go above and beyond what's federally required. Descriptions of any involvement from like the public, and that can be anyone that's not staff or students. And then how updates are made available to that same group of constituents, the policy leadership, specifically naming at least one person that has the authority to make changes that are discussed. And then the evaluation plan for the policy. So if you go back and look, 3 of those content requirements are specific to food and beverages that the schools market, providers, and or sell to students. And so there's a really strong emphasis around that nutritional piece and like how we're shaping, because ultimately that's what's happening at school, shaping how students and sometimes your colleagues and yourself, your staff, but how the relationship with food and beverages is formed. And so that I think is a really key piece to just take note of. So for DC, we have some process requirements. And those requirements are in the Healthy Schools Act. They do have to be included in the policy as well, even though they're not from the USDA, because the USDA does give local districts the authority to place their own specific tailored needs. So we have at DC, not me personally, but the Healthy Schools Act includes goals or must include goals for improving the environmental sustainability of school, plans for increasing the use of locally grown, locally processed, and unprocessed foods from growers engaged in sustainable agriculture processes or practices, and then plans for increasing physical activity, which overlaps with the federal goal for that, as well as goals for implementing and developing, if you don't already have one, environmental literacy plan. And just for the environmental literacy plan, I will say it sounds like a huge lift. OSSE has actually already developed one. My colleague Grace has done an amazing job with that. And so if any of you have questions over time around that environmental literacy piece, I'm happy to answer the questions I can, but also to connect you with her and share our website with you so that way you can access some of those resources and supports as well. So some of the additional requirements that exist in DC are around health and wellness, and those are things that are also in the Healthy Schools Act, but do not have to be in the local wellness policy. And the reason, and I will own this, the reason I put them all into these resources and into these documents is because just like the school health profiles, having everything that's related to health and wellness in one place is just easier. It makes it easier to find, right? So when you do the school health profiles and you have a document like the local wellness policy that creates space for everything, you then can look at the two and it becomes a lot easier to keep track of what's happening. It becomes a lot easier to make the updates and note the updates as you're filling out the profiles each year, because that is an annual thing. And so some of the things that are included that are local requirements, but not necessarily required to be included at a district level are elements from the Healthy Schools Act, from the Student Health Care Act, Human Healthcare and Safety Act, the School Safety Omnibus Amendment Act, Youth Suicide Prevention and School Climate Survey. So if that's like YRBS, I'm sure you're familiar with YRBS. We did that this year. And then there's also State Board of Education requirements that mostly center for, like, that focuses on high schools specifically. So for those of you that don't work with high school students, that last one doesn't necessarily apply to you. And so now we get to the fun part. So now we're going to go into the resources. The guide is a more detailed deep dive into what the requirements are, like we just talked about, an overview of how the policy itself in the template is designed and organized, and that is to align with the whole school, whole community, whole child model. And it describes what that model is and why it's important. There's some information, resources, and guidance on putting together a local wellness committee. It takes it a step further and actually identifies what a high quality policy is. with some points and like supports to create your own. And then there's also information on how you can implement it and evaluate and maintain your policy at your school. The guide also has appendices that have resources, local resources that are specific to the DC community. And then it has broader national resources and links that will help you support or help you design and implement some of the pieces that you may put into your policy. So if as you're completing the policy and using the new template and you don't necessarily see the resources you need, reference the guide and the appendices, because that's where you're going to find a lot of really helpful information. So as I mentioned, one of the pieces in the guide is having a high quality template and a high quality local wellness policy. And the reason that's important to me and to us at OSSE is because the more inclusive and comprehensive and high quality the policy is, the better the students and staff outcomes will be. So the idea is to highlight collaboration and making sure you're getting input from various sources. So having a student representative on the committee, having staff, having someone not just from leadership, but maybe the custodial staff, from the a school counselor, having parents, having a coach from one of the athletic teams, maybe people who participate or work with before or after care. And that way, all of the different avenues and lanes and possible ideas that you can get from having a variety of people will help enrich the policy. The availability is important because having it posted and accessible in languages that as many people as possible can understand mean that everyone can buy in, everyone can read it, they can see where they might be able to support, add ideas, recommend changes, join for the following year, take over leadership if they're zealous enough. Engagement is obviously important because without inputs from everyone and constant conversation, as the climate in the world changes, as current events happen, as school climate changes, there's personnel changes, all of that helps to keep people engaged or to find out what the engaged people are seeing and what they need to improve the policy for their specific either LEA or for the specific school, because sometimes as we know, LEAs are different sizes and there may be a number of schools under one umbrella. Making sure that it's comprehensive so that it does comply with all of the USDA requirements, all of the Healthy Schools Act local wellness policy requirements. And then as a bonus, what makes it high quality is addressing all of the other health and wellness related requirements in one place. And a lot of it you'll find as we go along, we talk about it, will overlap. But that just makes it a lot easier, as I said, to then go back and complete your school health profiles and have like meaningful conversations, whether it's with myself, my colleagues around supports that you need from us, and also getting the support that you need from your peers. It is WISC model aligned. That's the whole school, whole community, whole child model. And there's a picture of it, so we'll talk about that a little bit later in the training. And then the last piece that we really highlighted for making sure the policy was high quality was inclusivity and making sure that any students or staff with disabilities have their needs reflected in that policy as well. So you're like, this is a lot to be high quality. This is not a federal requirement. This is just, like I said, for the zealous people. So having it evidence-based, this is where resources that exist in the guide come in handy. I was intentional about including resources specific to your LEAs, whether it's some of the YRBS results we got from students in DC. So that's the type of data that I need. So having it be evidence-based reflects that, you know, the people creating the policy and implementing it genuinely care about it having an impact on an LEA school level. Making sure it's feasible, right? Because you don't want to create goals that are just not achievable just for the sake of creating them. And so making sure they're measurable, they're relevant, they're really clear, not having a goal that is completely unattainable. And so in trying to implement it, it's either impossible, or in implementing it, it's very difficult to track progress. Making sure that it's customized to your LEA is one of the things that make the local wellness policy local. And so while, yes, it is a USDA requirement, there are plenty of opportunities to customize it to your LEA to really tap into that local piece. and address needs that you may have that other LEAs in the district aren't necessarily faced with. So ensuring that it includes a process for evaluation and revision, going into perhaps a little more detail, defining the roles and responsibilities of who is involved in the development, the implementation, how it's being monitored, and maybe even taking a step to identify by role. So that way, if there is staff turnover, the person that steps into that role next is the person that's going to then take on ownership or leadership of a specific portion of the policy or the entire piece. Making it stratified by grade bands. This is really getting into the nitty gritty, but if it's a middle school, the needs of a 5th or 6th grader may be different from that of an 8th grader. And so when you get into the idea of stratification, that really starts to get down into the weeds, but there is room to genuinely serve an LEA and the students and even the staff that work with them in very meaningful ways. And then, of course, the biggest piece, as with most things in a school building, is leadership and support, right? So if you have leadership that genuinely supports what you're working on, what you're writing into policy, the goals that you set, it'll be a lot easier to champion it across the board and have it be a normed part of that school experience. So next, we're going to talk about the template. As I mentioned, it is aligned to the WISC model. So it's small, so you can't really see it here, but the WISC model has 10 components, and each section is based on a component. So whether it's health education, and physical activity, nutrition environment and services, physical environment, social and emotional climate, employee wellness, family engagement, community involvement, counseling and psychological services, health services. Those are all portions or components of the WISC model. And the way they're organized in the template is just the same way that they're listed here. I jumped around when I was stating them, but they're listed in order on this page, and then they're also in the template in the corresponding order. So how you're using the template is going to be following a color code. Everything is color coded by the level of requirement, and all of the other resources are color coded in this same way. So while the guide doesn't necessarily fit this bill and isn't WISC aligned, the template itself is WISC aligned and color coded, and it is yellow for everything that is a USDA local wellness policy or federal Healthy Schools Act local wellness policy requirement. So everything that's shaded yellow in the template and all the other resources has to be written out, very clearly included in the policy document. Everything that is green is a DC level requirement. There's one federal level requirement for reimbursable meal signage. But aside from that, it doesn't have to be included in the document, but everything green is a requirement that schools have to meet. They just you don't have to put it in the actual policy itself. So it is included if you would like to, if you have a policy around it, if it exists somewhere else and you want to just put it into this document, I definitely encourage you to do that. I invite you to do that to make it easier for you to keep track of everything, but green does not have to be included, but it does need to be completed. And then blue are recommendations. And the recommendations do not have to be included. They do not have to be considered, in all honesty, where they came from, because I know that there are generally questions around that. In 2018, I had some focus groups with representatives from different LEAs and different DC agencies, and we came up with various things that school leaders, staff, partners felt was necessary to improve the health of the staff, the students, and any like community-related community members. So completing the template, as I said, the yellow sections must be included because those are specifically local wellness policy requirements. The green sections are recommended because they are DC health laws related to health and wellness. So in this screenshot, it's a split between the health education section, which is the first section in the guide. You may not be able to read it, but it's just discussing Carnegie units. And that's a physical education or health requirement for graduation for high school students. So Carnegie units is not something that applies to pre-K, kindergarten, elementary schools, middle schools. But it's in here because it is a requirement for high schools. High schools do not have to write that they're making sure it's met, but they do still have to meet it. The yellow requirement is discussing like the identification of goals for increasing physical activity and any other school-based activities that promote student wellness. So because it's in yellow, that part needs to be filled in for all grade bands, every stratification, whatever level, that has to be filled in. So the blue sections, as I said, are recommended for improved quality. So two of the recommendations here are measuring broad perception of student access to quality mental health supports. Another recommendation that's on screen is providing a designated physical safe space for LGBTQ students. And these exist under a number of different sections. So under, for example, the employee wellness section, since this is a call with employees, one of the things I got from focus groups was having the opportunity to meet with a licensed psychologist or a therapist during the school day as like a part of PD once a month. So that recommendation is an example of what it would be for an employee. And any of these recommendations can be changed to fit your schools. So if your students have a safe space, then maybe you take out the LGBTQ safe space because you already have it, or you add, we have it and we're going to add something else for a different group too. So that's an example of how the recommendations can be used. You can customize those as well. So prior to each of the shaded boxes with the requirements, there is a statement of compliance. It is fill in, so it'll have LEA name where you just put in the name of your LEA. And the statement basically just says that you're very clear about what the importance is of this component, whether in this case it's physical education and physical activity. You understand how healthy quality physical education improves student readiness. And then you fill in, by filling in your LEA name in that statement, it's saying that you are in fact affirming you're aware of it, you're committed to executing on the requirements, and then right below that is where you fill in how you plan on executing and kind of meeting the requirements. So the next resource we have is a checklist. Just like the template, it is also organized by color. The checklist is not required. It's I guess it's a 1.5 page document that literally has check boxes that allow you, as you're completing your policy, if you choose to use our new template, you can go through the checklist and make sure that you've actually touched on the pieces that need to be included. So again, it's organized in the same order. You can go through it very quickly, check off, okay, I got all of the yellow shaded federal local wellness policy requirements. I still have to get to 2 local or district level local wellness policy requirements. And after that, I can talk with my team about whether we want to get into the Healthy Schools Act requirements that are in green, or if we want to do recommendations. So the requirements checklist is pretty straightforward, very short document. It's literally just a checklist, no details, no attachments, no hyperlinks. It's just check and go. So for the evaluation piece, this is where the triennial assessment details come into play. And I wanted to go over this before we actually look at the triennial assessment resource. The federal regulations do establish this, as we talked about, that they came into play in 2016. And so it's interested, the triennial assessment is covering what descriptions are included, whether it's a description of and here it's written in actual, like the actual languages of the manner in which. What that means is how, like describe how the parents, students, and representatives are informed about their opportunity to participate, are allowed to include or are allowed to be involved in the development and in the implementation and any updates that are made, then again, it's required that you include a description of how you're measuring how the policy is implemented. You know, whether you are keeping percentages or you're using a health tracker app or whatever the method is. And so there are some resources out there. Some of it, some things are a lot easier to measure than others, but we do have some supports and we'll provide like more detailed technical assistance around those elements. But making sure that you clearly describe how the implementation is going and how it's being measured and how you're reporting that information out. And then the third piece to that is just making sure that the public knows that they can participate and that they're aware of any changes or updates that are made. And so that's also a description of like, how is the public being informed? How are they made aware of changes? How are they invited to participate? So the next piece, the triennial assessment, requires you to review. Of course, it's triennial, and so that does in fact mean once every 3 years. It's just assessing how the school is complying with the policy that the school created for itself, right? So you're checking your own progress. And then once that's done, you have to measure, like you're measuring the implementation, you're comparing it to a model policy, you're discussing progress made toward attaining any of the goals that you had established initially. You're looking at either a model policy and what, like we are working on creating a model policy for you, but there's also examples and links to model policies that we'll share. And then also just making sure that once all of that is done, putting any updates or modifications that are made up on the website, so those are accessible. And so the last piece of it is record keeping, making sure that you're complying with all the community involvement requirements, making sure that there is proof that the triennial assessment was completed and that primarily is taken care of by just making sure that that's available to the public, whether it's being posted on your school website and a copy kept in the front office or emailed, a PDF email that, you know, is non-editable so that everyone who participated or it's part of the school community can be aware. And then having documentation for each school if there is, so if you have multiple local wellness policies in your LEA because you have multiple school sites, making sure that each of those schools have their policy assessed as well. So district level triennial assessment requirements, this is just from the Healthy Schools Act. Goals have to be assessed on a triennial, at the triennial assessment. It's improving the environmental sustainability of schools, increasing locally grown, locally processed and unprocessed foods, increasing physical activity, and developing and implementing that environmental literacy plan. Because those are local level, but they are part of the local wellness policy requirements at the district level, they do in fact need to be included in the triennial assessment as well. So once the assessment is complete, then the policy just needs to be posted on the website if one exists, distributed to food service staff members, distributed to parent-teacher organizations if one exists, and made available in the school office. So legislative resources around the policy or for the triennial assessment include like links to the Federal Register, like federal registration, the USDA local wellness policy resources, and Healthy Schools Acts. And these are links that we'll be able to share. They will live on our website and they'll be hyperlinked in this document. So once this is posted, the accompanying PowerPoint without me talking will also be made available, and you'll be able to access these links as you develop your resources and your cross-referencing. Some additional resources we will provide are model policies from Alliance for Healthier Generation and other resources that they have. Also, Indiana's Department of Education has a really helpful triennial assessment rubric. OSSE created our own triennial assessment rubric, and part of the reason for that is because our template has specific pieces that are specific to the district. And so while it's good to have a high-level rubric that does cover the USDA requirements, which Indiana's does, it doesn't actually, one, it doesn't match the template we have, but it also doesn't include district-level requirements. So my best encouragement, strongest encouragement is to use ours if you're also using our template. And so that said, now we're going to look at the rubric. So as I mentioned with the other sections, this one is also color coordinated. Yellow means it must be included. So here, if you're measuring the impact and implementation of your policy, you can, whatever process you have established for measuring impact, you can either check whether you're meeting goal, like are you having the impact it was intended to have when you wrote it. If it's partially, or if it's not at all, then you just describe what happened, right? If you're not meeting it at all, for example, let's say your triennial assessment was due 2021, but schools were closed for 1.5 years because of a global pandemic. You might then check not meeting goal, and in the description put, not that we were all confused about it, but a global pandemic happened and no one was in the building for us to work on any of these things. So at current, we are not meeting them. Our plan is to resume implementation when school reopens. So that's an example. And as much as I would like to say an extreme example, it is actually not, because there were schools who had local wellness policies due then. And we're able to, they just quite honestly reflect that. And so there's plenty of room for flexibility and for describing process, progress, next steps, and having collaborative conversations, whether it's with myself or some of my colleagues, to support whatever challenges you're facing along the way. So it also includes boxes and checklists for the Healthy Schools Act, local level requirements, Student Safety Act, and all of the other district level requirements that are related to health and wellness that do not have to be included. But if you do, you can also assess those here if you so choose. There are also here under employee wellness, some of the recommendations, and one federal requirement to make sure that employees are aware of their opportunity and the ability to participate. So for each section, this is, as you can see, still WISC aligned, still color coded by each section, and still makes it very easy to kind of go through and check off the boxes that you need to check and write your descriptions for each section. So next steps. So we do plan on rolling out a series of technical assistance opportunities, likely office hours for those of you who want to switch templates, for any schools. And now I think we have only 2 days left. So if there are any of you who haven't yet accepted the waiver and want to complete your triennial assessment, you have until the end of the day on June 30th to complete it and submit it. So if that's something you do want to do, then I would encourage you to email us. Like ASAP. We'll be sharing some dates to receive some live support and technical assistance with developing a high quality local wellness policy for any LEAs that are interested. I have had the pleasure of reviewing a number of high quality local wellness policies using our new template. Thurgood Marshall it's a high school, and so there's a lot of things that Thurgood Marshall Academy didn't include because they didn't need to, but they went above and beyond in including all of the Healthy Schools Act requirements. They included recommendations. Apple Tree has also done that, as well as E.L. Haynes, and so that kind of gives you a full spectrum of schools from early education all the way through high school that have taken the time to develop high quality local wellness policies. I've met with each of them one-on-one to provide technical assistance and help support. But I did want to give them a shout out because they're doing some really great things, and hopefully we'll be able to take a page from their books and work on adding more high quality local wellness policies in the district. And then we'll also be providing information on how to submit your policy to us for a high quality evaluation. And whether that's just an email that you send in or like actually establishing a one-on-one with me, we'll see based on what the demand is. So if you have additional information, if you don't want to wait for the to come to be determined technical assistance, because like I said, you want to complete your triennial assessment by the 30th, definitely please do email us at osse.schoolhealth@dc.gov. It is a team inbox. My name is Marie. You can address the email to me if you want. I check the email inbox along with my colleagues, but we do keep a close eye on anything that we get. And if it's specific to a specific piece of either this training or a piece of local wellness policy legislation or a resource, feel free to put that in your subject title. So I do want to thank you all for coming. I know a lot of you have had questions around what the local wellness policy is, and we're looking for more detailed training on it. I'm glad you're able to attend. I don't know if you have any questions, but I'm happy to take questions.
Hey, Marie, I don't see any questions in the chat, but at this time, we welcome you all to.
Yeah, it looks like Aisha maybe has unmuted and has a question, but we can't hear her. Can't hear you.
Sorry, I just unmuted and then Nigel bopped in, so I quieted down for a second. So you mentioned, I think you said E.L. Haynes and another school that had high quality plans. Is that something you could share with other people?
Well, I think because their plans are still under development and underway. Actually, I wonder, Thurgood Marshall's plan may be posted on their website already. So because it is actually required to be posted if the school has a website, these plans will be posted on school websites. So it isn't necessarily a hush-hush secret, right? So
no, I know that. You mentioned a couple of schools and I just wanted to know if it was possible to see them.
Yeah, I can, I mean, I can include either the list of schools that have high quality policies.
Okay.
If we're sending out a follow-up email, and Nigel can correct me if I'm wrong, if we do send one out, then it would be pretty easy to just include one or two of those schools' sites so that you can access their policies and see what they did and how they put it together. Is there a specific grade band you wanted? Because Apple Tree also went above and beyond, and that's for a younger age group. So
right. We're a K through 12 school, so all grade bands. But it would be good to read what other people are doing.
Trina has a question.
Yes, Marie, I can help read the questions for you if that's helpful. So Trina's asking, what email do I send the waiver to? So maybe Nigel, if you want to just go back to that slide and put that back up there. Okay, so here is the email address, osse.schoolhealth@dc.gov. And then we have another question. Is there a link to what are approved snacks?
Yes. So there are links to the USDA's like smart snacks. And there's like a bunch of resources around those, the like list, if you will, but there's a bunch of resources to help support you in like creating or getting. I think Alex just dropped the link.
Yeah. USDA came out with a new, like updated smart snack guide. So I did it's in our Google folder for those of you that have access on the, for the nutrition team. And in NSLP resources, smart snacks, there's information on smart snacks, but I just dropped the guide in here for everybody. But if you don't have access, let me know and I can drop the PDF version in. Okay, we have another question. Enforcement is a struggle. Are there some best practices that you can share?
So I think it depends on what aspect of or what area of enforcement, right? So if it's enforcement with, let's say, physical activity, then building it into the school schedule and also having sort of a checks and balances system where there are not just someone in a position of authority on the policy, but also having staff and student representatives so that they're in the building in different locations if it's built into the schedule. An example of ensuring that the goals are being worked towards is the school-wide Tuesday morning, first Tuesday of the week, or first Tuesday of the month, sorry, school-wide 10-minute yoga is a requirement, right? Because it's in the schedule. But if the fifth grade was absolutely out of order the day before, now the punishment can't be, oh, well, fifth grade doesn't get to participate. And not saying that any of you use physical activity or limit it as a means of punishment, because we know that. But in the event the thought occurred, having it on the schedule as a practice that's school-wide now means the entire school has to do it. It's a lot easier to be held accountable by peers. I understand like that may not cover the example that the question is referring to. And so I think that may be a more case-by-case basis that requires typical one-on-one TA to sort of troubleshoot what some of those challenges are.
Hi, Marie. This is Marjorie from C Public Charter School, and that was my question about enforcement. It's more like the teenagers smuggling snacks in their book bags. They are aware of the Healthy School Act. They are aware of the wellness plan. However, they are teenagers. So, you know, sneaking iced coffees in sippy cups. And I mean, they're getting really creative about how they're sneaking food in.
Yeah. So I think one of the challenges with that is understanding the policy is putting a lot of the onus on the school and those on the committee developing the policy to create policies that meet or exceed USDA's requirements for what you're providing, selling, or marketing. So if you aren't marketing the coffee to them, but they're bringing it in, you can have a policy separately, like you could add your own piece that is any student found to be drinking coffee is getting a demerit, or either can immediately throw it out before walking in the building, or they get a demerit, you know, and you can add those sorts of things. But as far as the local wellness policy adherence, because it's focusing on school enforcement or school, what the school's providing, what the school is selling, what the school is marketing, it's a lot different than if you were marketing the coffee to them and then selling them the coffee and selling them the snacks, because they're bringing it in on their own and you aren't marketing, selling, or providing them to the students. It's more about creating a discipline system, perhaps, to keep them from bringing, you know, hot Cheetos or iced coffee into the building.
Okay, thank you.
We have another question. So if some of the suggested programs are incorporated into the extended day program, does that count?
So I think because every school day has a different model, sometimes that is necessary. So if we are talking about environmental literacy programs where there's an after-school trip to a watershed, yes, that does count as working towards a goal to improve or implement environmental literacy plan. And it depends on the structure of your school day. I know we do have some adult schools or alternate school models that also have to work around very specific structures. And so that's where sort of tailoring your policy to your needs really will play a big role in how effective you can be with it.
Thanks. I'm not seeing any other questions, but let's just give people a couple minutes if they wanted to come off mute.
While we are holding for additional questions, you all, I'm going to drop a link to an evaluation in the chat. Please let us know how we did today so that we can enhance the training that we provide to you all. So I'm going to drop that link in just a second.
You saw there another one came in, Marie. I saw you reading it. It says, when is the waiver due?
So you have to accept it by the end of the day on June 30th. So since today is Tuesday, you have until Thursday, end of day. And you can just send us an email to osce.schoolhealth@dc.gov. It's on the screen. And yes, even though you're asking in chat and I can see who's asking, send the email because we are actually required to respond with confirmation of receipt. And when you accept the waiver, I will note that for those of you on the call who have accepted it, when you submit your triennial assessment over the course of the next year, you don't have to wait till June of next year to submit it. It just means that yours isn't due Thursday. But when you do submit it, you will also need to still include a description of how the extension has helped you implement the goals in your policy. So that was one of these stipulations.
Hannah, what is due on Thursday? I'm not even totally sure what's due on Thursday.
So either a completed triennial assessment, if your LEA is due, or the waiver accepting. So there's a USDA waiver that basically says, due to our response to COVID-19, the challenges that we've faced, we've had some difficulty with the local wellness policy. They're granting an additional 1 year to LEAs to complete their triennial assessment.
And how do you know if you are due for your triennial assessment?
I have emailed. So I think
okay.
If you didn't get the email, then you may
then
not
be probably not due. Okay.
But I have the information, so I can actually look at it while we're live on the call. That is technical support. So if you want to tell me what LEA, I can tell you.
Capital City Public Charter School.
Yes. So that communication went to Jonathan Weinstein. And so you can follow up with him as to what he wants to do.
Okay, but there is one due, is that?
Yes. Yeah.
Got it. Okay, thank you.
And then Marie, we also, Washington Global asked, okay, everyone's asking, so it's no problem. While Marie's looking up, so Washington Global Mundo Verde, I think it would be helpful just to give a little bit of context. So if your school did not open in the last, 2-3 years, then your LWP triennial assessment was due June 30th, 2020 for everybody. And then USDA gave everybody a waiver. And so most people accepted the waiver, and then it was due 21st, 2020. And then they did it again. So we're on like the third round of waivers for the LWP. So if you either already did your waiver, or I'm sorry, you already did your triennial assessment and you don't have to worry about it for 3 years, or you've accepted the waiver multiple times. And so if you accept it again, then it's just giving you another year to do your triennial assessment. So Marie can look up and see, but if yours, there's a chance that some people on this call either have the 3 waivers, could potentially have missed it and had it due last year, which is okay. You just want to make sure you do it, because we will come and check during administrative review. That's when we check for compliance on the triennial assessment. So it's very complicated because it was due a couple years ago, and now we're on multiple rounds of waivers and you have to keep accepting it every time. And unfortunately, this waiver acceptance does not align with all of the other waivers that you have during the school year. So I understand why there's like some confusion on this specific waiver, because if you upload it with your meal application, it's too late from the USDA deadline. So I hope that explains why there's questions about this right now. Okay, so Marie, oh, she's responding in the chat. Okay.
Sheesh.
So the waiver is, you just email. You don't need the waiver. You just email Marie. So right here, ossie@schoolhealth.dc.gov, just email her, say your school, and say you want the waiver. And that's all you need to do. There's nothing else to fill out. Again, it would be really easy if it was just aligned with all of the other school meal waivers, but it's not. So that's why this one is a little bit different of a process.
I do want to add, like Alex said, because of the offers for waivers and some LEAs accepting them and then having their timeline changed, while I've kept track of it, I think some of the challenge too is that the names, all of the names on this call, I recognize a number of them because you're actually also the point of contact for it. But there may be individuals at your school who are receiving the emails and have the information and know whether you're due to complete the assessment or accept the waiver this year. And so maybe checking with your school leadership to find out who the point of contact is or whose name may be listed if you are the point of contact, but your contact information isn't what we have specifically for the local wellness policy. So that may be helpful too. And then once you get in touch with them, just either have them send me another email and I can confirm, or I can resend the information to the new contact.
Okay, so Marie, it looks like you answered for Washington Global. That one's due June of 2023. Breakthrough, same thing, June 2023. Girls Global is asking you to check. Girls Global is one of our newer SFAs, so they are not on the same timeline of having it due. You don't need the waiver because your 3 years starts in your second year of operation. So I think that is this your first year or second year? Can't remember.
I don't think, but Girls Global, I don't have as being due.
Second year. Okay, so Cynthia, if this is your second year of operation, you had last year to create your LWP. This is technically your first year of your LWP, so yours is going to be due in 2024. You're on a different timeline than everybody else since you're a newer SFA. Okay, Mary McLeod Bethune, June 30th, 23.
Cedar Tree is also 2023.
Okay, same thing with Cedar Tree. Two Rivers is asking.
Two Rivers 2023 as well.
Okay, Mundo Verde. Did you get Mundo Verde?
They're 2023. Most of these are actually
Responded. Okay, cool.
23.
I'm sorry, the chat isn't working for me. I have a question. I'm with Social Justice School, and next year will be our third year in operation. So when is it due?
So for social justice, your LWP is due at the end of year 3, but technically you have the first year in operation to create your LWP. So once your LWP was created, so if you started school with an LWP when your charter started, then that would be year 1. But let's say you took the first year to create your LWP. It's whenever your LWP goes to effect, you have 3 years after that. So if social justice started year 1 with an active LWP, then it would be at the end of that third year. But if they took that first year to create their LWP, it's at the end of that fourth year.
Okay, so do we then need a waiver? Are we due?
Don't need the waiver, no. So I think yours is likely due in June 2024, because that will be your fourth year of operation for your charter school.
Okay, thank you so much.
Yeah, no problem. Yeah, it's like everyone was grandfathered into this on the same track, and then all the new SFAs that are joining or LEAs that are joining are on different cycles because of course, you know, you don't have to open your charter school and have a triennial assessment due that year.
Right, and I'm seeing a number of people who are asking, and so I do that, some that have already accepted, like requested the waiver this year that I responded to. If you requested it and I responded to you, or maybe you might have sent it like yesterday and I didn't respond yet. So I think I only went through the request from Friday so far. Yours is not going to be due until 2023. Monument, yours is due 2023 as well. So a number of these are not due until June 30th of 2023. And then for IDEA, I know you just did do your triennial assessment. So if you choose to submit, you just did the administrative review. If you choose to submit the local wellness policy triennial assessment, you have 2 days to do it. If not, you can request the waiver. But oh, you already requested the waiver, sorry. So yours is currently due 2023, but it's up to you if you want to switch to the new policy. You can use the current policy that you had, that you went through the administrative review with, to do the triennial assessment. And then the updates that you worked on with that administrative review can be kept in the new policy, if that makes sense.
Marie, I can't recall if you said Eagle and LEYC.
I don't think I actually said. Eagle Academy is due 2023. LAYC is now also due 2023. They accepted the waiver this year, so they were due this year, but they have an extension. And then I see here there's a question from Cynthia, will we be notified? I may have missed that. Notified specifically about what?
My guess is if they got the waiver or not.
Yes, so because we are required to respond, you will get a notification back from us, an email that says we've accepted, like we received your request and it's been granted. Also, I do see there's a hand raised. I don't know if it's Ayana. Do you have another question? I can't see whose hand it is.
I think they might have asked it. I see the hand went down.
Oh, okay.
Hi, this is Cynthia. I was wondering if we did just have our administrative review, and I recall doing the LWP based on our policies this school year. And does that still require a waiver, or am I just waiting until 2022? I know I'm not the point of contact. I have to figure out who that is.
Cynthia, are you at Girls Global?
Yes.
Oh, okay. So you had to make an update to your LWP. And so it just means there's like something missing in it, one of the requirements. So that was already done for Girls Global, so that's great. So your triennial assessment is not due until 2024. Since this is your second year in operation, it's really like the first year in your LWP cycle. So your triennial assessment is due in 2024. You had an update to your LWP, which was completed. So that just means like OSSE reviewed your LWP and it has everything that that is needed within that. What I don't remember is if you recreated it using the new template or if you used the old template and just updated it. So if you wanted to use the new template that Marie went over today, you're welcome, of course, to create an LWP using the new template. Okay, so BASIS, just so I'm understanding, BASIS needs to accept the waiver. They should send you an email.
Yes, it said that I guess Trina sent it. So once I go back into the inbox.
Oh, great. Okay, cool. The last one I see in here, Shining Stars.
Yeah, Shining Stars. Oh, I didn't respond to them, but the 2023 was for Shining Stars.
Oh, thank you.
Shining Stars is due June 30th, 2023 as well. And so I don't know if there are others of you that may have questions, but you can just email the inbox once you talk with your point of contacts to make sure that they didn't already receive notification that it was due and accept the waiver. So those notifications that triennial assessments were due went out 2 weeks ago, and any organizations, LEAs, SFAs that were able to or eligible to receive or accept the waiver were informed that they could do so. So a number have already, which is why so many of you aren't due until 2023. So just definitely double check with your colleagues around whether or not they've accepted it yet, and then get back to me with the acceptance if it hasn't happened by the end of the day on Thursday, June 30th.
Hannah, one last question. Who would that notification have come from?
It's from our OSSE school health email account, but it would say Marie Williams because I drafted it.
Okay, perfect. Thank you.
You're welcome. And it may have gone to like a junk folder or spam folder.
But Marie, while she's trying to trace down the email, it's okay for her to send an email to you correctly.
Okay, thank
Correct.
you.
Yeah. So
Absolutely.
yeah, Aisha, you can send it to Marie, even if it went to John. Feel free, you can shoot her an email. It doesn't have to be him.
And then I guess lastly, if there is a point of contact for the local wellness plan, can we redesignate the point of contact? Because I think that might be helpful too. Or can we update that? I guess I'll add that in my email. Okay.
Yeah, that works.
Okay, thanks.
And then since we put a lot into the chat, Nigel redropped the feedback link, so it's fresh for you guys if you don't mind filling that out. And Marie, Malika's reconfirming for IDEA. I can't remember if you said or not. I thought you did.
It is.
Okay, 2023. Great.
You're welcome. I'm happy to answer any additional questions. Excited that all of you are so engaged and that you came to participate. So I really do appreciate the engagement, the interaction in the chat, and those of you coming off mute. And I just want to say thank you again. Because it feels good, one, to see your names and like some of you see your faces. And so
can I just ask a quick question? This is Cedar Tree Academy. We're not due until June 23rd, you said, but what is due? Is it the assessment or should we redo the plan using the new template?
So what's due is the triennial assessment. Once you do your assessment, as you're revising your plan, because the idea of the assessment is to also spur updates, right? Like this now, the policy you now have, depending on how many waivers you accepted, is 6 years old, or maybe 5 years old, but 6 years old. And so at this point, there may be additional needs or better resources that exist from when it was first developed. So yes, it's the triennial assessments that's due, but then I would just encourage those of you who are completing it to switch to the new template, update the policy. Some of the goals and some of the things established may still very much apply as you move forward, but it's just an idea to sort of refresh everything, put any updates that are necessary in, and start fresh.
Great, thank you.
Okay, so The guide and the template can be accessed on our website, and I can put a link in the chat.
Marie, while you're putting that link in the chat, I'll also be sending out an email with the links to the templates as well as a link to this recording and a copy of this presentation for you all. But Marie, please feel free to still drop those in the chat.
Oh, perfect. Thank you, Nigel. So I just put a link to the main website, but the resources, as Nigel said, will be shared. So stand by. And if you got the email for this training, then you are the one that will get the email for the resources or with the resources.